which is by Asela Gunesekera, Ashen, Wanniarachchi, Dewanmini, I hope that is correct, Wanasinghe, Dewanmini, and Upekha Gamage, and they are going to talk about a meta-analysis on e-health practices to suggest emerging areas of e-health services within Sri Lanka. And the presenter will be, who is the presenter is? Excuse me.
All of us are presenters. Three of us.
All three are going to present, okay. And so anyway, this says Asela is a PhD student of KDU and a lecturer in the same university. Ashen, Dewanmini and Upekha are from Gender Joint University, third year undergraduate students following the PSc ICT degree. Right, go ahead.
Session Chair, Professor Gihandayas, ladies and gentlemen, a very good morning to all of you and welcome to our research presentation. It is fascinating to see how fast the technology around us advances and how it influences the betterment of human life. Today we are here to present you a meta-analysis on public sector e-health practices to suggest emerging areas of e-health services within Sri Lanka. This research was done by Mr. Asela Gunesekera, Ashen, Wanniarachchi, Dewanmini, Wanasinghe and myself, Upekha Gamage. So let us take you through our presentation. In our presentation we will be discussing the key components of our research, starting from what is e-health, our research question, the basic design of our research, the current e-health situation in Sri Lanka, how information technology can help enhance the health sector in Sri Lanka, limitations and restrictions of these enhancements, and finally the qualitative and quantitative conclusions we came upon eventually. So before we move on to the research question, I think it's worthwhile to know what e-health is. As per the World Health Organization's definition, e-health is the transfer of health resources and health care by electronic means. To ease up and clarify this definition, let's have a look at this flow diagram. On to the left of the flow, we have three main sections of the as the foundation of architectural model. Those are e-health solutions, communication network, and stakeholders. A stakeholder is a person with an interest or concern on something. And in our situation, there are four types of stakeholders. Those are health service administrators who have direct connection with all three subsectors of the communication network, and health service consumers who have the direct connection to health web portals, and private and state health service providers who are having access to state health networks and the internet portals. And if we take an example, the health service consumers, or in other words, patients, can request health solutions via health web portals. And if a state hospital lacks some sort of medicine, it can access the state health network directly, or access internet portals and request the required medicine. Again, that is e-health. This whole system is governed by Health Information Management Solution, and the double arrows trot out the back and forth connectivity of these respected areas. So far we have discussed the nature of e-health. So let's dig deep within our research. Our research was based on two main questions. First, we tried to understand the position of our e-health system by looking into current e-health practices in Sri Lanka. Then we explored the reasons for less e-health practices in the government sector. Furthermore, we sought the e-health users in Sri Lanka, and we found out that several organizations use e-health solutions in the administrative and consumer services. Some of the organizations are Ministry of Health, University of Colombo, Medical Research Institute, and Base Hospital Dompe. And we researched why it is necessary to upgrade the situation of the e-health in the government sector. And another major concern was to grab the high authorities' attraction in this matter, because it's always easy when policymakers and high authorities' attraction is drawn to a certain matter. So we tried to find out the best ways to do so. And our research was designed in such a way, taking the maximum usage of available and reliable sources to make our research more accurate. Let me brief you about our research methodology that we used from the beginning of our research from the last year. Our research design was mainly based on the meta-analysis method, and it was also aided with one-on-one interviews as well. In the meta-analysis, we could investigate well-known, well-recognized, successful researchers, and we were able to find out the present situation of e-health and how the ICT infrastructure of Sri Lanka, and several researchers and the surveys are presented in this slide. And we used face-to-face interviews and over the phone interviews because those kind of techniques work well in these kind of studies, and we were able to gather a considerable amount of information on the current state of e-health from respective heads such as Dr. Mahanama Gunesekera, Senior Surgeon in Kalutara General Hospital, and Mr. Chandana Gunesekera, Senior Manager of Sri Lanka Mobitel. So I think now you have an idea about the nature of e-health and how we conducted our research. So let's see what are the findings of our research. The analysis part of our research will be continued by Ashen Wanniarachchi. Over to you, Ashen.
Thank you, Upekha. Well, as we discussed so far, I think now you will have a better understanding about the phenomena of e-health. So, one of the major objectives of a meta-analysis is to investigate about the current e-health services available in Sri Lanka. So, in here, it has been listed down the available e-health services in the public sector of Sri Lanka. As the first, the web portal is the most frequently used and the popular e-health service. It provides information related to the health sector to the public. The people who are in the thirst of seeking information about various health matters can access the web portal, search information, and clarify their doubts. In order to enhance the user interactivity and the user friendliness of the web portal, it has been facilitated with the preferred language. So you can use the web portal in Sinhala, English, or Tamil as you prefer. Rather than providing information into the public center, this can be used also as an educational resource for medical students too. And when it is coming to the second point, telemedicine. Telemedicine is the technology of exchange medical information from one side to another using the electronic communication. It context of the telecare, telehealth, and the remote patient management. If I am talking something surrounding about the telemedicine, most projects related to the telemedicine were started in year 2003. Those were funded by the World Health Organization as a part of their Southeast Region Health Telematics System. In the initial stage, they covered 5 districts as Kandy, Tissamaharama, Hambantota, Ampara, and the Hiyatikandiya. In addition to this, another 2 most important projects were executed as Vidusuwa and the Sri Lankan Health Telematics System. The Vidusuwa project was executed by ICTA together with the University of Colombo in order to enhance the performance in the remote patient care management, and the intention of establishing Sri Lankan health telematics is to facilitate the medical professionals or doctors to work within a virtual environment, like go for alternative solutions and get advices from their consultants. And the lab information management system was established covering all the units of the Medical Research Institute in order to manage the process running on there. And then the M-Health program provided by the Sri Lankan Mobitel is considered as the most reliable and the successful e-health service running in Sri Lanka. Through that, it enables a patient to ask for a OPD doctor to channel order to ask for a doctor by just sending SMS. And the last point, the Masters in Biomedical Informatics offered by the University of Colombo is established in order to develop the education related to the e-health services. Through that, it is incorporating the ICT skills together with the health sector and the other sciences program. So, when it is referring to the details we discussed so far, it proves that Sri Lankan government, together with the Ministry of Health, has executed so many projects in order to enhance the usage of e-health within Sri Lanka.